Welcome back, and I'm super excited to have Dr. David Johnson here with me today. Welcome. Now, Dr. Johnson is a neurosurgeon, and we talk a lot about the fact that we've got so many health professions out there who are now advocating nutrition as a way of treating illness rather than with medication, etc. after the fact. So, welcome and thank you for joining us.
Thank you for
how
having
did you
me.
actually come across low carb high fat and using it within your practice to help treat your patients?
Well, I initially became aware of low carb high fat through personal experience. I really felt that I was a pretty healthy person, but at the same token I was getting overweight. I went for a life insurance check. I wanted to get a secure life insurance policy, and I had to go to a GP. And the GP said to me, "David, I can't tick you off on this policy because your blood pressure's 140, and you haven't been running here. You're not out of breath. It's not like you just ran up a flight of stairs."
Yep.
And he rechecked it a few times. I said, "No, this doesn't meet the criteria for the policy that you're chasing." And so I thought, this is really strange, because I eat well. I was still exercising a lot, running, swimming, tennis, golf, surfing, and having a medical background. I was pretty confident of my understanding of what was required to be healthy. And then I looked at there was another time where we were looking at some home videos, and it was around Christmas time, and we were playing a video game called We Dance, or the dancing one. Yeah. And we were all in the lounge room, and I didn't have a shirt on, and I looked at that video, and I had love handles, and at the time I was about 93 kilograms. Now I'm 78 kilograms.
Wow.
And it just sort of dawned on me that there's something that I'm not doing that is compromising my health. And so then one thing led to another, and then within my own practice alone as a neurosurgeon and doing a lot of spine surgery, I was always weighing up the risks and benefits of people's spine surgery, and every single patient that pretty much had to go to surgery was morbidly obese. And I would talk to the patients about what is happening to help you get on top of your obesity, and the common response was, my doctor just tells me to eat less food and exercise more, but I can't exercise because I'm in pain. I've got this condition. And so after a few years of noticing this, it just stimulated an interest in why so many patients were overweight. And then one thing led to another, and being invited along to speak at Low Carb Down Under, and developing our own policies about or protocols about how to manage neurosurgical patients led to more interest, and then it really became a passion. And then you start to notice improvements in your own health and your family's health, and that sort of fuels the fire. And so here we are today, talking to you about something that's very, very distant from my advanced training. But sometimes when I reflect back on our early days at university, first year medical student, the things that we're talking about now, they are really part of the medical degree. And the biochemistry, the physiology, the pharmacology, it is part of the medical degree. Right. But it sort of gets lost. It gets lost as we become more advanced and almost too smart for our own good, and we lose sight of the foundational elements that are required for health. Right. And we're too busy thinking about fancy drugs and fancy surgical procedures and chemotherapy and radiotherapy, and you've got to do this and that. Super expensive, super dangerous, but we've lost sight of the fact that, hang on, if we just eat well, that's going to, number one, maybe prevent a lot of suffering, and number two, optimize what modern medicine can offer in terms of restoring health. So.
Well, it's a fabulous story, and you would never guess by looking at you that you'd even gone through that. You couldn't imagine it because you look so fit and well.
Yep.
So when you were, struggling with your weight a little bit and, had those love handles, etc., did you, what were you eating at that time? Obviously, you'd been taught how to eat healthily. What sort of things were you...
Our favourite thing was setting the bread maker for 3 a.m. to have beautiful, hot, warm toast.
And whole
loaf
grain?
Of bread. We would have porridge, all the healthy cereals, just right. Mueslis, that was the health. Orange juice. It would be a little bit frantic in the morning, trying to get ready for work, get the young kids ready for school. So it was also convenient, and we thought it was healthy. It was uncommon that we would have a hot breakfast.
Right.
Uncommon that we would have a hot breakfast. And nowadays we have a hot breakfast every morning. Monday through to Sunday, hot breakfast every morning. Our kids do not know what Weet-Bix is.
Right.
It's bacon and eggs, omelette, sausage, avocado, mushroom, tomato, butter, every single morning, and we just get up about half an hour earlier. And even when we just started doing that one simple thing, without changing anything in terms of physical activity, just kept things the same. Just go for your jogs and play sport, enjoy life. We just started noticing massive changes. My belt, I had to get a new belt within about a month. And it was just like, wow, this is amazing. I'm feeling better. I've made such a tiny change to my lifestyle. There's got to be something in this. And then you go back and then of course, how could I have been so silly? As a scientifically trained professional, I just lost sight. I lost sight of the way that carbohydrates interact with your metabolism. And then it's just so clear that I try to tell people now that the things that I'm telling you, or when I'm educating my patients, it's not complicated stuff. It's really, really basic science. And I say, look, I'm a surgeon, I'm a carpenter. I'm not a smart doctor. I'm a carpenter, a carpenter for the human body. And I wouldn't be able to understand this if it was complicated. But if I can understand this basic science, then you can too. And believe it or not, just with a little bit of information, some pamphlets and brochures that sort of spell it out really simply, that's all patients need. And like yourself, we've all got fantastic success stories with patients losing 10, 20, 30, and I saw a patient last week, Bridget, hello Bridget if you're watching, who's lost 50 kilograms. 50 kilograms, and just by changing her diet. And she was a sick lady, and did have to have some spinal operations, but her success is due in part to the nutritional changes. I said to her that if we'd done the surgery and you hadn't have made those nutritional changes, I can promise you that you would not be feeling as good as you feel today, and you would not have transformed your life into a healthy human being again. From someone who is the exact opposite, depressed, overweight, in pain, unhappy, living with her parents, lost a job, lost relationships. So those are the things that really motivate you. And sometimes you have bad days where other doctors will even contact me and say, what are you doing telling my patient to eat more healthy fat, more fat? What are you trying to do, kill them? They've already had a heart attack or something like that. And so you've got to take the ups with the downs, but often I'll have those conversations and say, look, do you know much about metabolic syndrome and chronic hyperinsulinemia, and speak a little bit more scientifically, and chronic inflammation? And then you very quickly understand that those professionals have lost sight. They're sort of lost in the forest, like I was 5 or 6 years ago.
Well, it's very easy to do, and like you mentioned, it is basic biochemistry that every single health professional has studied. But we tend to forget it as we move on, because we've got this low-fat thing that's drummed into us over and over again, and it's so strong that if you question it, you suddenly become the odd one out. So you can see how it does get lost, and how doctors do get caught up in the whole idea.
Yeah.
But yeah, if we can go back to basic biochemistry, it just makes all the difference.
It's just really unfortunate that when people are overweight and the word fat is used, and the atherosclerosis in your blood vessels looks yellow and oily and fatty, and so it's an easy argument to persuade someone to stop eating fat. That's just really
absolutely.
unfortunate.
Absolutely.
But that's not how our metabolism works. Our metabolism is not a drain pipe.
Yeah.
That if you liquid oil sets in the drain pipe, yes, it will block it. But our metabolism is completely different to that. It's not that sort of simplistic.
Yeah, it's quite interesting going back to see where all this, idea about fats being bad for us and clogging the drain pipes came from, and to actually go back to the history and see where it all came from and see how the sugar industry actually, went to Harvard researchers and tried to get them to, change people's perceptions, because at that time there was a lot of research showing that sugar caused heart disease, and they paid them to basically change the perception that fat was the culprit. And of course we had Ansel Keys who, came out with that research that we now understand was cherry-picked and, bad science. And unfortunately it's just, continued on, and now we have this situation where it's the accepted thing, and those of us who are questioning it, have to kind of go uphill to change perceptions again.
It's almost like whose job is it to show that carbohydrates or fat is the villain, and sometimes I think almost the burden of proof should lie with the sugar industries. Like, well, instead of me saying fat's not bad for you, you show me where sugar is good for you. Why is it not that way? But it's just that the economy and the multi-billion dollars of profits that these industries make can pretty much educate the public. And it worries me now that that these sort of industries are actually educating our dietitians and these our nutritionists and our doctors. They're almost writing the textbooks. They're almost writing the textbooks that our professionals are reading now and studying from. And they can do it because they have unlimited resources.
Absolutely.
And it's only voices like yourself and a few doctors and groups like Low Carb Australia and Low Carb Down Under that are really trying to put it out there. And we do it out of we do it out of passion and out of professional obligation. And the Hippocratic Oath, we do it because it's sort of born into us that we want to help. But I don't receive a single penny by suggesting to someone to eat healthy food and stop eating sugar. That doesn't do anything for me. But conversely, Milo, who puts a 4.5-star health rating on their product, has a lot to gain by selling Milo or promoting Milo as a health product. And it's borderlining on criminal, I think. It's borderlining on criminal. And we just have to take a step back and say, well, what the heck has our society come to when 50% of adults, like 1 in 2 adults, are pre-diabetic or diabetic? That's massive, and that's costing everyone, every single taxpayer, 50 cents in the dollar, paying tax is supporting those sick people.
It's really reaching crisis point, isn't it?
It is a crisis, and that's why you can't sort of have the stance of gentle, in moderation, everything in moderation. That sort of annoys me a bit, because when you've got a crisis, you don't turn around and say, "Oh, look, we'll sort it out. Just it's all okay. We'll sort it out slowly." When there were the Brisbane floods on, and everyone was stranded. It wasn't, oh, it's okay, we'll be there in a little while. It is a crisis, and you have to treat that crisis appropriately. And having 1 in 2 adults pre-diabetic is a crisis.
Absolutely, and then we've got all the other things. They're expecting over 1 million people with dementia by in a few years' time.
Yep.
And what is the healthcare system going to do with all these people? They don't know,
we're in trouble.
We're going to be in a lot of trouble.
The budget deficit is $50 billion, and that could be eliminated in 1 year if we all changed our idea of what was healthy food.
Absolutely.
I'll tell you a little story about a patient of mine that was in hospital recently who was diet-controlled diabetic. And when he was at home, he would check his sugars. He used to hover around 7 or 8. He came into hospital to have a procedure done with me, and the nurses rang me up over a couple of days just saying, oh, so-and-so's blood sugars are sort of creeping up and they've now hit 20.
Wow.
And I said, what is he eating? And they said, he's on the diabetic diet.
Yeah.
He's on the diabetic diet, and I rang the patient myself. I said, what have you had for brekkie this morning? And he said, yeah, they've given me toast, marmalade, wheat bix, and orange juice.
Basically everything that's going to put your blood sugar up.
That is our diabetic. And I said, stop. And I rang the nurse back and said, I do not want my patient on the diabetic diet. I know he's diabetic, but I want him on the hospital low-carb diet. And I'm the chairman of our hospital nutrition committee, and we've formulated a low-carb diet, which anyone can have.
That's fabulous.
But he was on the diabetic diet because he's ticked, diet-controlled diabetes. And by the next meal that night, I wanted a sugar check, and he was back down to 7. By coming off the diabetic diet. And that shows you how muddied the waters are, even with our hospital diabetic service. It's very concerning.
It absolutely is, and I think, if you look at how people with insulin resistance actually react to carbohydrates, it's absolutely criminal that we are encouraging them to have so many carbohydrates and basing their diet on carbohydrates. So I don't understand how we can continue to do it when we see, the nurse obviously saw that, and
wheat bix are healthy, and porridge is healthy, and they see their other family relatives or the neighbour. What do you have for breakfast? Oh yeah, I have muesli and porridge every day too, and they're fine and they're skinny or slim and look healthy, but it's really hard to explain to someone that their metabolism is not the same. And the analogies that I use are like someone who's allergic to bees will not own a beehive. They won't have a beehive in their backyard. Whereas someone who has no allergy to bees can have a beehive. They can have 10 beehives. So if you're allergic or intolerant to carbohydrate, it doesn't matter whether they are the healthy carbs or a Mars bar. If you're allergic to those carbohydrates, because they are the same thing, then you should not have that product. You should not have that macronutrient. Just like if you're allergic to bees, you don't have bees in your backyard in a beehive. Once you reverse that allergy, so once you are more tolerant to carbohydrates, then fine, you can have your muesli or your porridge for breakfast again. But most people who have reached that stage where they've regained their insulin sensitivity or diminished their allergy, they actually find that they don't really want to go back onto those foods because they're so accustomed now and satiated and satisfied by the luxurious style of eating that LCHF, low carb healthy fat, affords. And so they don't really want to go back to wheat because the last thing I want for breakfast now, after 2 years or nearly 3 years of eating LCHF, the last thing I'm thinking of when I wake up is that I want to have toast. I wake up, I want to have my omelette with cheese and mushrooms and tomato and cracked pepper on the top.
Absolutely.
That's what I want to wake up and have. And but I think that's worked for my patients. A lot of the patients, just getting them around to understanding why their husband may be able to have the same breakfast as them and still remain slim because they've got a different level of insulin sensitivity.
Yeah.
And once they've lost that insulin sensitivity, it doesn't matter whether it's a Mars bar or whether it's porridge or multigrain bread or sourdough, it's still glucose.
Yeah,
and glucose has the
absolutely.
same effect on them
Yeah.
as a Mars bar.
Yeah, and I mean, we've seen in studies that complex carbohydrates in insulin resistant people, you know, spikes their insulin and blood sugar just as much as
Yep.
sugar can in many cases. So
Yep.
it's an absolute travesty that we're not recognising this and taking away the food that is actually making them sick.
Yeah.
And you know, in many cases we are making people diabetic by getting them to follow the diabetic guidelines.
That's exactly what happens. That's exactly what happens. And the nutrition guidelines are still very heavily laden with, you know, the healthy carbs. And unfortunately, that's not going to reverse the problem for 50% of the population who are still allergic to carbohydrates.
Absolutely.
So.
And in fact, there's a study that shows that back in the 60s, they studied healthy populations that hadn't been exposed to, you know, to modern society, and they showed that it takes about 20 years on 22 teaspoons of sugar to make that population diabetic. 22 teaspoons per day. Well, our dietary guidelines, our recommendation is 22.5 teaspoons of sugar a day. That's their recommendation. So we are giving people diabetes by not changing our guidelines. So it's great to see you doing this type of work. And what sort of, you know, what's the main difference that you've noticed in your patients from, you know, giving them a little bit of nutritional help along with the medical advice that you give them?
One of my patients was here today, Liesl, and it was just fantastic. I didn't recognise her. I saw her sort of middle of 2015, and she came to see me with the concern of headaches, and she was overweight. She was 30 kilograms heavier when I saw her, and my advice was, you know, reassuring her that the headaches were not a brain tumour, for instance. That's not what everyone worries about. And in talking to her about her condition, we also talked about nutrition, and by her adopting that LCHF lifestyle, headaches gone, mental, you know, her outlook on life just through the roof, back to uni, then about to graduate, and lost 30 kilograms.
Yeah, amazing.
You know, there is no surgery, there is no drug, there is no quick fix, and it just reinforces that food is medicine. Food is the most powerful medicine.
Absolutely.
And it's you know, one of the foundations of health. If you don't have good solid foundations, no matter what fancy scientific or modern medical procedure you throw into the mix, if you don't have the foundations there, it's going to fail. It's like building a house. It's like building a beautiful house like this and having really nice windows and curtains and doorknobs, and then you've got dodgy foundations. It's just a waste of time. It's just going to collapse around you. And so that's one of the things that really satisfies me, is that they might come and see me for their spinal condition or their brain condition, and we fix that, but the actual process of making them healthy is through addressing foundations, and nutrition being one of the most important foundations for just generating true health.
Wonderful. Well, thank you so much for joining us. I hope that
pleasure.
other
My
doctors
pleasure.
can take a leaf out of your book and maybe look at nutrition as part of what they do in their general practice. So I appreciate you speaking out. It's, you know, it takes guts to do that sometimes, but it's absolutely fantastic, you know, to see doctors actually talking about this. So
My pleasure. Thank you for inviting me.
you're very welcome. And thank you everyone, and we'll see you soon.